Hello and welcome back to Chronically. This one is going to be a bite size about a topic I would delve much deeper into in the next few episodes. I want you to think about the last time you've left a doctor's office or finished a virtual appointment. Did you get this little email a day after, the one that say, how did we do? Please take our survey. Sometimes you comment, and sometimes you actually fill the survey and you wonder what happened to this survey. Like, did this data just disappear into some sort of a digital void? So today I wanted to pull back the curtain on that process. I'm going to talk about something called patient experience data. It might sound like corporate talk, but I promise you this is one of the most powerful and underutilized tool we have as patients. It's so much in a survey, and it's something that can not only make service better, but shape the way we are being treated. So when we hear the word data, we think of numbers, spreadsheets, and lab results. Data without soul, but patient experience data is different. It's the story of our journey through the healthcare system. It's like the hardness of the waiting room chair when you kind of push back against. It's kind of the relief that floods through when your doctor finally says the words, "I believe you." It's the frustration of trying to navigate a phone tree, just get to a prescription refill, or fill out many admin form over and over and over again. It's the small kindness from a nurse that change your entire day. These things, the feelings, the obstacles, the moments of connection, they aren't just fluff. They are actually crucial data. There are data points, and they measure not only service or medication interaction and so on. They can measure dignity, respect, and feasibility. Feasibility for a treatment plan that is better. Something that is more adjusted to you and suited to you as a patient. Your experience data can prove that your patient journey is the wrong one for you, that your medications are not good for you or doing great for you, that you need to change the doses. It can prove that a certain diet is helping you. It can prove that an emotional intervention is helping you and that you have enough support system. It's all together. So what happened when we share this data? Does it actually do anything? Does it serve anything? When you share your story, it might feel maybe like a drop in the ocean, but when this drop combines with hundreds or thousands of millions, it becomes a wave that cannot be ignored. This data is what convinced a hospital to change visiting hours or be more friendly to working caregivers. It's the evidence that proves that new medication side effects are impacting quality of life more than a clinical trial suggested. It's the proof that clinic needs maybe to hire a patient navigator, a case manager, or to improve its service because the communication system is a bit broken. Your experience, when documented, stop being just your problem and start becoming a part of a collective solution. It builds the business case or the business feasibility for compassion. It builds empathy from an evidence-based data and not only as a whim of somebody who cares more or less about patient feeling. So how can we do it effectively without it feeling like another burden? I think I have two simple low energy tips. I'm talking, of course, from the patient side at the moment. I'm not talking about the people who analyzes the data, right? So for patients or caregivers, the first 30-second debrief after the appointment, when you get back to your car or to the public transport and you sit down at home, just take 30 seconds, open the note app on your phone and write down 2 things. One thing that went well and one thing that could have been better. That's it. Over time, you'll build your own powerful evidence file. Second, translate symptoms into impact. This is like a game changer for your appointments. Instead of just saying, my fatigue is bad, translate it. Say, my fatigue is so significantly worsened that I have to choose between taking a shower or making breakfast in the morning. My fatigue is bad is a feeling. I have to choose between showering and eating is hard, undeniable data points that can make your functional capacity translated into medical language. It gives your care team a crystal clear picture of your condition. Your life with chronic condition has made you an expert. You're a subject matter and you are the expert of navigating your own health journey. So these few steps can really help you translate this data. But what if you want to take it a notch up, kind of? For example, I document symptoms and I document special events occurring in my illness. I have a spreadsheet on my phone note app and I record every time I have severe pain or fever or any crash or what I called an attack or anything that is out of the ordinary. When you let an AI tool like Gemini or ChatGPT analyze those tens or dozens or hundreds of data points, you can translate it to your physicians. For the people who are actually developing solutions, they're doing IT in healthcare, providing organizations, we need better ways to have a two-way street of interaction. I really don't understand why it's so one-sided that doctors are extracting information out of patients and it's sometimes translated into something and sometimes you don't know what it's used for. Sometimes I'm speaking, 30, 40 minutes to a doctor and then they write 5 lines in the medical summary. So they lost probably 95% of data points there. One of my startups, DocMe, was actually that. We provided a pre-appointment links for surveys that really helped generate this data. And it was really, really helpful. It was a bit too early for its time. But now, when we have the technology and we have the acceptance, I don't see why patients should not document more and providers should not collect more, translate it into something tangible, and send it back. There is a good example from Israel. One of the HMOs there, when you're finishing an appointment, you're immediately getting an email saying, the doctor diagnosed you with a cold, for example. This is what we recommend to do in a cold. So like medication recommendation, supplements, behavior recommendation, and so on. And this is very simple. It's just based on a few data points of do you have a cold or not? Do you have a fever or so on? Imagine what happened if this email takes into account dozens or hundreds of data points. Then an AI language model is suiting for you, drafting a sort of an email guide of what's happening next. It's not about just, you have this prescription, the pharmacist will tell you what to do. It's an entire ecosystem that can be made. Your experience is not just passive. It's not byproduct of your illness. It's not something that only a handful of very brave souls are using into raise awareness raising or advocacy. Next time you get a link to a survey, or even if you don't, next time you speak to a doctor or a nurse, remember, you're not just complaining or sharing a story. You're providing evidence. You're a researcher in the study of your own life. Studies shows that in the best absolute cases, only 70% of the information a doctor needs from the patient is coming through because of culture, communication style, lack of time. It's time that we automate it. It's time that we actually make it 100% and maybe even 300%, because instead of just asking questions, answering them, we can generate data, evidence-based points that can really shape the way we are being treated. Thank you for listening to this chronically bite-sized episode. Remember, be kind to yourself, and I'll talk to you in the next time.